Okay, I'm going to just do a quick safety message, and then we'll move forward with the meeting. Anyway, when we talk about safety and transportation, we often think about the basics: seatbelts fastened, vehicles maintained, defensive driving, accessible securements properly in place. And those things absolutely matter. They protect lives in very real and immediate ways. But in our work, especially serving individuals with disabilities, veterans, and an aging population, safety goes far beyond what happens inside a vehicle. Safety is making sure someone isn't stranded after a medical appointment. Safety is confirming a veteran gets to critical mental health services. Safety is ensuring that an aging adult doesn't have to choose between getting groceries and filling a prescription. Safety is clear communication, reliable referrals, and partnerships that actually follow through. Every agency at this table contributes to safety in ways that aren't always visible. Case managers who check in, volunteer drivers who wait until someone is safely inside their home, dispatchers who make that extra call, providers who recognize when something feels off and they act on it. For many of the people that we serve, safety isn't just physical, it's emotional, financial, and social. It's dignity, it's independence, it's knowing that someone is paying attention. As we continue our coordinated mobility efforts, I invite all of us to ask, are our processes trauma-informed? Are we reducing barriers or unintentionally creating them? Are we communicating in ways that promote clarity and prevent confusion? Transportation may be the vehicle, but partnership is our safety net. I just want to thank each of you for all of the work that you do every day to keep our communities not just moving, but protected, supported, and seen. Okay, I am now going to do a quick update on the referral line and temporary trips. We currently have 180 individuals that have called into the referral line, and that's just since July 1st of 2025 that we started being able to keep track of that. 81 of those individuals have been approved for temporary trips, and an additional 38 are in progress. 19 of those have been started but not submitted, which means maybe they called in but didn't have all the information available to the individuals taking those calls. And we've only had to deny one person as ineligible. And as of February 5th, we've authorized 1,859 trips. 543 of those have been billed for, and those only include trips through the end of December. And for those of you who are helping people, find out about the referral line or letting them know, we have started adding an expiration date to the trips, which in the beginning we were not. They were just kind of open-ended, but we have started adding that based on the need. Typically 30 to 45 days is the window that we're allowing right now, but just so that people are aware. I am going to let Christy take over now and give us a vehicle update.
Well, actually, there's not much to update on vehicles because for, I think, the first time in 10 years, we're basically caught up. So we have 2 vehicles left for our friend Susie, and those are here. Jerry's working on getting a time scheduled for her to pick those up. So that being said, thumbs up. I think we are on our cycle for the grant. We have sort of like a 2-year cycle for things. And yeah, thank you. It seems to be, we are finally, after many things, including COVID and build schedules from these vendors we use and stuff, maybe, do I dare say it out loud? Things are to normalcy, but I don't know. We'll see. That being said, I believe Alika had put in when you're applying for the grant, some estimated costs of vehicles. I mean, they're still expensive. That is what it is. I'm sorry. But, we're happy to fund those, get those vehicles in. Our vendor for the transits has been really great. Those are built. So I put in the order for those and then those are built, but the build has been much quicker than in the past. So that seems to be going well. Just depends on how many, we do have some on what we call on the state vendors list. We do have some suppliers now for minivan, ADA minivans and the cutaways. So it makes makes it a little bit easier and quicker to get those. And then, of course, we get any non-accessible from just local dealers that have government contracts. So most of them are pretty, hopefully will continue to be fairly quick, what we consider quick in our world. So right now we have no orders in. We're waiting for everybody's grants, see what gets awarded, and then we will move forward on getting some orders taken care of. That being said, Trista did have a note on here, which is true. If you have any problems with your vehicle, be sure to loop me in. If your vehicle is still under warranty, I can help you with the vendor to get things taken care of for your vehicle, okay? The newer vehicles will still be under warranty. Warranty, I'm sorry, is a bit of a squishy thing here only because our procurement department keeps that on file and all that. But typically, you know, if your vehicle is under a couple of years old, we can usually get the vendor to help us get things fixed if there's a problem. So be sure to involve me and I'll be happy to help you with any fixes, particularly on the newer vehicles. So please remember that. I'm very excited to see so many new organizations today on this call. I think that's awesome. I hope we really try to work together with these different organizations for transportation and try to help each other and help each other's clients. So I hope that even if you don't apply for the grant this time, I know Alec is going to talk a lot about that next, Alec and Jerry. But if you're not applying for the grant, I really encourage you to continue to come this year and get ready for the next grant cycle in 2 years. But I say that because we have things like temporary trips that might be able to help some people, some of your clients. And we'll talk about that later in the meeting a bit. But and some of these other organizations may be able to help you with some ideas and partners. So it's a really good group to be involved with and try to tackle some of your transportation issues for the clients that you serve. So that's my soapbox for the moment. I'll have another one, I'm sure, some point in this meeting. And I am done. I'll turn it back to Trista.
Thank you, Christy. I know a lot of you are frantically working on your applications for this grant cycle, so we've dedicated a big chunk of this meeting to Alika and talking about the grant and being able to answer any questions that people might have. So I'm going to let her take over. Alika, do you want to share your screen or would you like me to do it?
Yeah, I can do that. Just a couple updates on the application. I was notified there was a section on the budget form that still said indirect cost section. So I did remove that and I put a new one in that doesn't have that. And I sent out a notice. So that's been fixed. The tables, people are having issues with the staffing tables. And I messed with it. It added an extra box and kind of, if you hover over, you'll see that the box doesn't align with the heading. And I don't know how to fix that. So if your email doesn't fit in the email box, just go to the next box because that is actually the correct box. It's okay. It doesn't matter. Wherever you can fit the information in the staffing table is totally fine. Or you can even upload an Excel spreadsheet with all of your staff and contact information if that's easier for you than using the table.
Let's say 8 o'clock.
I'm gonna
Okay.
walk in front of you.
Yep.
Just a reminder that applications are due midnight on March 1st. That is a Sunday because last time we had it on Friday and everyone begged me to move it to Sunday. So this time I just did it on Sunday at midnight. So that if you have to work on the weekend, I hope you don't, but it's available to you. The pre-applications have all been reviewed and you should have access to the application if your pre-application was approved. I know I've already seen a couple applications get submitted, so that's awesome. I will start reviewing those and I will reach out to you if there are missing items or errors found on your application so that you can have a chance to fix them before they get scored. I do not work Friday the 27th, but I will try and keep an eye on emails. It's hard for me to answer my phone on Fridays, but if you send your question by email, I will try to answer it when I can. But if you're having issues with Zoom grants and you can't get a hold of me, you can contact them at questions@zoomgrants.com, or they also have a phone number. If you click the little help button, it's kind of hard to see in Zoom grants, but there is a button that says help in the upper right-hand corner, and then it will give you their contact information, or you can submit a ticket with them if you're having issues. But it's not the end of the world. If you have issues, just email me and let me know, and we'll deal with it next week when we can get to it, or, whatever, if it's something like that. Okay. I left this from last time just so you can still have these dates up, but application is due. We already talked about that. Then I'll do the review process from February to the end of March. And then we will start scoring. And then remember, in April, we'll have the LCCs where you can come present to the GMAT and answer any questions that they have. For Salt Lake, that might be hard. I'm going to tell you how many minutes you'll each have because it'll be more compressed in Salt Lake just because we have more applicants in this UZA. So you might not have as much time in Salt Lake to answer questions and talk, but I will let you know how much time you have. And then the GMAT will meet after the LCC in April and discuss final awards. Lydia, do you have a question?
I do. In your application review process, it says February 1st to March 31st, but then in the description, it says open for corrections until March 1st. Should that be
Oh,
March
sorry.
31st?
Yes, it should be March 31st.
Thank you.
Thank you. But we might have to start scoring before then. So we'll see how that aligns. I don't think that people will need that long to make corrections, but we'll see what happens. Hopefully not, so we can get scoring. Jerry had some good ideas for lunch and learns for this year. So I wanted to see feedback on lunch and learns, if these would be helpful for you. She worked with, I don't know if you want to talk about it, Jerry, but she worked with some agencies on QR codes for their pre and post trip inspections, how they scan them. And she thinks that it could be a useful tool for other agencies to do their pre and post trip inspections that way, and maybe other forms. So if you're interested, that is a lunch and learn that she could do. A vehicles 101 kind of update on Ride Pilot stuff and what's required. And then social media, because we do get questions sometimes about sharing UTA and LCC information and stuff on social media. And she could also help you with, I don't know, posts and stuff. Jerry, did you want to add anything? Oh no.
The QR code line, I just recently helped Feral Care with it, and I think they really like it. So I think if you're open to it, it's a great idea to add in the QR code system. It eliminates a lot of work and a lot of tracking by hand. It does a lot of things for you. So I do highly recommend, even if you're not certain you'll use it, to at least take the time to sit in and listen about it and see if it's something that could work for you. And the social media, just making sure we're able to help you with getting word out about your agencies and services that you provide, as well as knowing our limitations with what we're able to post and talk about on the UTA social media accounts in a way that we can bridge that gap so everyone feels like their agency has the awareness that it needs throughout the community.
Perfect. Thank you. And then also we'll do post award training this year, and it will probably be in September or end of August. So that's kind of what the year looks like. We could do more lunch and learns, but I feel like on an application year, it's very busy. So probably we don't want to do too many. And then next year we could do more. So let me know if you have ideas or feedback on that. And then Jerry can talk about site visits.
Okay, first things first, everybody that I've met with in person or virtually for your site visits, for 2025. Thank you so much. You've all been so great. It's been super easy. You guys are doing great. It's been nice to actually meet everybody in person and get to walk through your agencies. We're wrapping up 2025. Everybody should have their completed results sent to them by early to mid-April, so we're just about done. With that being said, obviously it's 2026. So that means you're getting your 2025 site visits and results into 2026. I want to put an end to that this year. So bear with me. I'm going to be reaching out to you guys in April, May, those of you that will have site visits for the 2026 year. And I'm going to get those scheduled starting in late September, early October. And the goal is that every sub will have their site visit results completed and sent out before 2027. So that way we're completing year of site visits within the year that they represent. So some of you are going to be having 2 site visits with me within a 365-day period, just this one time. And then once we get through it, it should hopefully be kept within the year that it's in. That'll also help with getting your risk assessments to you a little bit quicker within the year so that you have those in ample time for when you need them. I think that's it for that, unless anyone has questions about site visits.
Okay, thank you. GMAT volunteers, just a last call for GMAT volunteers. If you have time to help with the GMAT and you're not applying this year, please send me an email. We need always as many people as we can get. It's usually just a small group, but you meet after the LCC. You can review the applications and give questions or raise concerns about the funding, project types, and then we have a discussion after the LCC about if anyone feels uncomfortable with certain projects, if you feel like they don't align with the Human Transportation Service Plan or they don't align with the goals and needs, gaps and strategies of your area. So if you have the time to help, please shoot me an email and I will send out instructions on the GMAT soon so that people can help and get started.
Alika,
Yes.
if they only serve Salt Lake but would like to serve on a GMAT for one of the other areas, can they do that?
Yes.
Okay.
I think because like Alyssa does all 3. Well, she's with Bragg. I don't think there's any rules about it. Christy, do you know? No.
I think as long as they're not evaluating their own.
Their
Yeah.
own,
So,
right? Yeah.
I think as long
I
they could do
would
the other
welcome
areas.
any volunteers.
And I think it's a great experience for everybody to go through at least once to understand that side
Yes.
of the application process. So I'd encourage everybody to look at their calendars, and if you can help out one of the other regions, if you don't serve those areas, it's a good idea.
Yes, I agree. Okay, thank you. I don't think I have anything else, so I'll open it for questions. Does anyone have questions about the application or timelines or anything like that? Okay. Thank you.
Wow. Thanks, Alika. Let's see. I am just about finished updating the human service transportation plans for each of the areas. But for your application, you'll use the ones that are on UTA's Coordinated Mobility website currently. But if I have reached out to you and asked for updated information on your agency, maybe your demographics, or if anything has changed from what we published in the last plan, and you have not gotten that to me, if you can please get that to me by the end of next week. Don't want you to stress this week with applications, but once the application's done, if you can get me that update by the following Friday so that I can get those plans finished, I would appreciate it. All right, we wanted to open up a discussion about the temporary trips. When we first talked about this, I know there was a lot of funding with the legislature that was in jeopardy, so we had wanted to discuss the need and what additional needs might be arising. Christy, do you want to talk about any of that?
Yeah, there's probably, well, for me, there's some things I'd like clarification on. I will tell you, so we here at UTA, we have a new government relations director. It's Paul Ray. A lot of you may know Paul Ray. He was a legislator for 20 years, and then he went over to Department of Health and Human Services. Now he is here at UTA. So he has some really good perspective on the things that we do and seems to be very, very engaged, which has been great. I had a quick chat with him yesterday, and he told me that the Medicaid transportation funding and the DSPD reimbursement was all restored and that they were not going to be taken out of the budgets this year. So that was good news because we've been really worried about that, as you might think, because we already don't have enough transportation money. We didn't need less. Temporary trips is a pilot. We have some latitude with the pilot to make exceptions or try some new things out. So we want to be able to help your organizations as we can. The funds are limited, but we have quite a bit of funds right now. We're still spending from the last grant cycle. And we're going to put in for this next one. I think what I'd like is all of you to consider, and we can discuss this when we go to look at the grant applications in April and what you want, what you would want to fund and what is needed. I think the priority really needs to be, trips and helping you get trips. So whether that's getting a vehicle, whether that's helping with operations, whether that's trying to see if we can get more people on temporary trips to help some of your organizations out. That being said, those are the things. Is Nels still on this call? Nels, are you still on this call? Maybe. I don't know if he's still on here. Can you see him, Trista? Is he on here?
I am looking. I don't see him currently.
Dang. Okay. Most of you probably know this. So Nels at least does a lot of the aging piece up there on the hill during this time because he works. He's in charge of the aging department for the state of Utah and our Department of Health and Human Services. And so I tried to get on, at least early in the session when they're looking at appropriations and things, I try to get on. And Nels has had to make a lot, presentations. I know some of you have made presentations. I would like to get a little feedback, if I can, from a few of your organizations on your perspective of I know that despite what's going on at the legislature, that I think there's been some federal impacts. So maybe I'm going to just call on a couple off the top of my head, if that's okay. Maybe my friends at Ability Inclusion Services, what is your insights right now as far as your transportation and funding moving forward the next couple of years?
I would need Shannon to speak to that, and
That you can't get.
no, and she's the mic is not working.
Okay.
I'm sorry.
That's okay.
We get so little in general when it comes to transportation. I mean, I do know that much. I don't know. It's always been a battle for us, definitely.
Sure. By the way, congratulations to Ability Inclusion Services. They just opened a new facility. We went to the ribbon cutting, new apartments for people that they serve. So they're really cool. They're over there in West Valley City, residential. So that was great. Happy when those things can happen.
We did, and thank you guys for your support.
Oh, of course, of course. Okay, how about Turn? Turn, you have lots of people on here. I don't know who wants to speak or whatever, but I would love to hear what impacts you're having for your day programs.
Fiona,
Well,
speak up.
Oh, there's
I'm
Fiona.
speaking.
Okay, go Fiona.
You
Thank
can't
you.
see me, but
I'll try to turn my camera back on. So, from what I understand, like you were saying, that a lot of the transportation funds was on the chopping block, as well as potential rate cuts for all of our individuals. But it sounds like all of that has been passed through, and we're not going to be receiving any cuts. Probably no COLA increases or anything like that as well, but at least they're not taking anything away at this point. Um, and just like was it Karina that was saying, the funding rates for transportation are really, really low. And so, we're just continuing to look forward to hopefully being able to maintain our third-party contracts that help us cover, the expenses for the transportation. And hopefully we can grow with that because it really makes a huge difference in our ability to do our jobs. So,
Right. Okay, third-party contract. Thank you. That's
Mhm.
helpful. We have Ashlyn. Did you want to say something? Go ahead.
Yeah, I can kind of speak to the budget aspect because I oversee the budgets for our company and involved pretty heavily with UX, our provider group. So the government is not taking off transportation at this point, but they are looping in the payment, which we call MTP, motor transportation payment, into other service codes. So we get what's called one-to-one staffing with day program called DSI or day support individual, and they're now not allotting MTP and DSI. They're looping it into one code and saying that's enough funding to serve people with adequate community outings and transportation. And so I see quite a bit of reaction. So I'm sure a lot of us probably wanted to speak to that. But I thought I'd just raise that as they're not necessarily cutting funding, but they are on the back end because they're not awarding it with that appropriate service code. And so that's been really, really frustrating. And with, the recent news article coming out about 2 weeks ago on the 3 gentlemen that were unfortunately killed during transportation for day hab services, I think that kind of prioritized it to the government. Senator Stratton's chair for Social Service Appropriations Committee. And I spoke with him over email and sent him the article, and they're aware that, the transportation's an issue and that probably wouldn't be under consideration following that event. So I just thought I'd give a little bit more of a concrete answer in transportation of where the government is, specifically Senator Stratton and Senator Fiafia, who is the vice chair of the Social Services Appropriation Committee. Well, Representative Fiafia, excuse me. But yeah, so there's a little bit tidbit to it is not taking away, but they're looping it in. So they are kind of taking it away.
Oh boy, I'm sorry. That's good to know. Because that can affect, right, what the needs are across you as partners. So that, again, especially for Salt Lake County, because as Alika said, we get a lot of applicants, right? It's our most populated area, obviously. So we have the most services, but that makes it hard. We have to, try to spread the money better, or at least make the most effective use we can. So, I encourage you all to really think about that as we move forward. I don't, you don't need to change what you're asking for in your grants. Please ask for what it is you want. That's totally fine. Just keep in mind though, that we would, like I say, we're emphasizing what we can do for helping you make the trips you need to make. If we here at UTA need to do more with the temporary trips, then we will see what we can do. We have an out of the box thought on, we don't know if it'll get funded. So I'm just going to put that right out there because it's not a typical request. It doesn't really fall under our tradition, like really what qualifies on 5310 per se, but it would save and free up trips. So we're going to submit it and see what happens. But what we're thinking of doing is submitting for some funding to buy like 1 year membership to like Walmart delivery, so that because there are some areas, and we do had Trista's done some research on this, that we can do a decent number of trips for grocery, right? And grocery is important, like, don't get me wrong, that's very important. But can we get some of the people who go to grocery off of the vehicles and get them food delivered? Can they order themselves? Do they have a caregiver? Can somebody at the senior center help them? That kind of thing, because then that would free up more trips for medical. As we all know, medical tends to be one of our hardest, most difficult areas of transportation. And I'm poking around and trying to find out how we make or have the medical industry, at least here in Utah, step up to the plate more on that. There's a perception that, everybody's responsible for getting people to medical appointments, but the medical industry. And they're the ones that, when people miss those appointments, that's a lot of money they lose. It hurts them the most as far as dollar wise. Now it's hurting our customers, right? It's hurting our clientele the most because they're not getting their health needs met when they can't get to places. And we realize a lot of our clients do not have the ability to drive or have somebody around typically to get them somewhere during the day for an appointment. So when we do the temporary trips, medical tends to be a priority, our dialysis and those kinds of things that make regular appointments. So all that to say, does anybody have feedback on that, if they think that might help some of their customers or clients if we were able to do,
Christy, can I just throw out what numbers real quick for people to understand what
Sure.
that means?
Sure.
So one person, this is just one customer, received 134 trips to the grocery store within 1 year. That would free up $7,200 in the average cost of a one-way trip to get people to and from medical appointments just by having a grocery subscription instead. So just so that kind of gives you a picture of what that could do financially for giving trips to those who need them. And that's why we started to look at this as an idea, as a transportation measure to see if it's a way we can free up more money.
And
it looks like somebody has a question.
Yeah. Yep. Steve, yeah. Steve, right?
Steve Yaffe.
Okay.
Yeah, I do have a question, but in answer, the TriMet subsidizes, I think it's DoorDash, I can find out, for the very reason that you cite. I'm in Charlotte, so a lot of this is new to me. The temporary trips thing, did that arise because you have a long waiting list for Medicaid waivers for IDDS?
There's many things. You should meet with some of the people on this call so you can get some keen insight. We are I believe, someone correct me if I'm wrong, the only state in the union that has a waiting list. We have a waiting list. Some people never get services. Some people are on that list 20 years. I think is it 6,000?
Over 6,000 people right now
on the waiting list for services. So that's a huge problem here in Utah. What was the other thing? Something else you said and it crossed my mind. Okay, you did. Oh, the temporary trips. So the temporary trips has started. So our pilot is, we here at UTA, we house a referral line. That referral line is for seniors and persons with disabilities and we help them find services. So, if they're a senior and they say for instance, they don't know how to get some transportation for whatever reason, they call in and maybe they live up in Bountiful, which is in Davis County. They may get referred to Davis County Aging, say for instance, or say they have a disability, but they don't know about the paratransit eligibility and haven't heard about that. So we may refer them to paratransit eligibility within UTA. But we have any number of people like on this call, organizations like on this call that we can refer people to hopefully get trips on a more permanent basis. So that being said, while they are waiting for eligibility, the idea is we're filling that gap while they wait for eligibility. For, again, maybe it's for paratransit or Davis Aging or whatever, because they may have doctor's appointments or things they really need to get to, and we don't want them stranded. So we fill that in. We have contracted services with our 5310 partners. So right now we have 3 5310 partners that we have service agreements with that can help with that transportation and take trips, make trips for these people, and then we pay for those trips. Again, with this being a pilot, some of it's case by case. If somebody, lives outside the 3/4 mile for paratransit, but they need dialysis and have no way to get there, we may fund all the dialysis trips. It's just, so it's a little bit case by case, depending on really what the need and what the issue is with the individual. This is not a long-term permanent solution. We don't serve anybody with the temporary trips permanently. I don't know how else to phrase that. So we do try to help them find other ways to get transportation in the long run. We would like to expand it a bit to serve after hours, weekends. We have a real problem with transportation for our clients during those times. These organizations, most of them, they can't function 24 hours. They don't have that capacity. And so it would be great if we could with temporary trips fill some of that. So that's a thought moving forward. But really what we try to do, Steve, is just, we're really, really trying. We have some pretty big gaps and needs here. And so we are trying to use the 5310 funds to the best of our ability to serve the most people we can through these organizations.
Thank you.
You're welcome. And if you want to meet with anybody or us or anything else, just reach out. We're happy to set something up or meet with you or whatever.
I'll be out there May 16th and 17th.
All right. Well, come see us. We'll be happy to have you come by. That being said, okay, so I think that's all on that. I will tell you, and I don't know how many of you this helps your clients. I don't want to go deep into this because I don't have much information yet. We have been asked to meet, possibly, when I say we, that's UTA as a whole. We may be helping, strangely, with some rural transportation, at least maybe on a consulting basis. I don't know what to call that. So there are, probably most of you are aware, again, Medicaid cuts. We are looking at, there are rural Medicaid funds coming to every state in the union, including UTA, and that's quite a bit of money. It's emphasized, though, for the rural areas, which we know that they have a lot of gaps. And there are a handful of you that serve rural customers. I know that your companies, go out to these places. So just keep in mind that the state of Utah helps sort of decide how that money gets programmed. And so there's some keen interest in funding medical transportation with some of those Medicaid funds to get people from rural areas into the urbanized areas. Because as we know, a lot of people, right, if like you're in Richfield, you might have to go into Provo to the hospital. Well, how are you getting there? Those kinds of things. It may involve some of you as partners once they're in the urbanized area. I really don't know yet. It could involve things like e-voucher, doing a voucher kind of situation as well. But I just want you to be aware of that. But I don't have a lot of details yet. We're sort of just barely meeting with some people from the state to see what those transportation solutions possibly could look like. So that being said, I think that's all I have on this part. So Trista, if you want to pick up or discuss anything more on temporary trips, or if anybody has any questions, feel free to ask.
I think you covered it pretty thoroughly. Are there any questions that anybody has? Okay, word is starting to get out. I'm starting to get calls from social workers at hospitals, doctors' offices. It's starting to show up in Google searches. So people are becoming more and more aware of the trips. So that's a good thing, but also could get a little crazy at the same time. So we are excited that people are becoming aware of this resource. Okay, if there's no questions, I don't see anybody with their hand raised. Christy, do you want to talk about SB 195?
Sure. You guys didn't get a very big break from me. Sorry. Sorry. But that being said, so refresher, and Steve, you won't know about this, and actually a handful of you who are newish probably haven't heard about this. But In the last year, in the 2025 legislative session, Senator Harper sponsored a bill called SB 195, which is, he is asking for a study for the urbanized area to look at possible consolidation solutions. Meaning, is there a way we can bring our services together? Is there a way that consolidating could make these dollars go farther, right? Now, so what's happening is that has been assigned to us and to UDOT. So we are working in tandem with UDOT on this, where it's a partnership study. They have a contracting company that they have hired. So we also work with a contractor that is spearheading things and keeping us all together. We meet every other week to discuss this. And then there is a meeting coming up. So any number of you may have gotten an email invite about the meeting on March 16th. That's a Monday. So Monday, March 16th at 10 a.m. That will be over at UDOT, which is over here in Taylorsville. Please come if you can. If you are interested in attending, please put in your new, we don't know if you're interested in attending, put something in the chat or email. You can email me or Alec, and you can email any of us, whoever's email you might have, and just say, I'd like an invite. I'll forward that invite to you. It's open to any of you that would like to attend. So what we'll be doing at that meeting, the agenda items that they have are, there's a project update and what work has been completed so far on the study. They have been doing data collection, so they're going to share the data collection information and the findings. They are going to go over gaps and needs that, they've gleaned from conversations plus previous studies that we've had. And then I believe they really want a lot of feedback. It's called a service consolidation round table. So they really want people's input as to maybe different scenarios. If we were to consolidate this piece, how would that affect your organization? What would that look like? If we were to consolidate this other thing, what would that look like and how that would affect you? So we really want anyone who can attend that does transportation for seniors and persons with disabilities to please come, and feel free to, give some feedback and find out what's going on with the study. We want the study to be accurate. The final study will go back to the Transportation Committee in November of this year. So they're on a pretty tight, time frame here to get this completed and done. So that is the next engagement meeting. On a side note, I will mention that I have been talking to an insurance company, Susie. Anyway, I have been talking with an insurance group to see.
Good, I'm excited.
Yeah, to see if we could do more of a policy for everybody that was a lower cost situation, and maybe even share vehicles, because as we all know, that's been one of the objectives of coordination, but it's almost impossible because of liability and things. So after speaking with them, the best way to do it may be basically going through URSTA, which is our transportation organization, which Trista will talk about in a second. But that being said, so they are presenting at the URSTA board meeting. We have an URSTA board meeting coming here in the spring, and this company is going to present to the board, and we'll discuss it and see how we could possibly move forward and bring that information back to everybody. So just keep that in mind. We are working on that. And maybe that's a piece of consolidation, right? Maybe if we could get everybody insured for less money, again, then that's just more money you can put in your program, because I know it's expensive.
Yes.
So
Yes.
That's all for me now. So thank you. And again, let me know if you want to go to the meeting. Send any one of us the email. It'll get to me and I'll get that forwarded to you. Thanks so much.
Thank you, Christy. Does anybody have any questions or anything they want to bring up before we kind of wrap up here? Okay. The URSTA conference is coming up. I know many of you have attended. For those of you who have not, it's a great conference put on. This year it's going to be in Price. We have a local bus rodeo for drivers to compete in, which is always fun. and it's going to be September 22nd to 25th. Registration is open, so if you go to the URSTA website, which I believe is just ursta.org, you can go ahead and get registered for that. There are some scholarships available. You can apply for a scholarship and they'll let you know if it's approved or not. That will help cover some of those expenses if it is approved. I encourage everybody to attend. There's always good classes, safety classes for drivers, safety classes for management. We have a mobility managers training for those who deal with a lot of that type of stuff. Usually some vendors there who like to show off their products and give out some swag. So there'll be a big night out on, I believe the rodeo is Thursday. I'm not sure the schedule this year, but I believe the rodeo is Thursday. And then Friday night is the big night out and the award ceremony for the winners of the rodeo. So it should be fun. We do not yet know what the big night out activity is going to be. The committee is working on that, but hopefully at our April meeting, I'll be able to announce what that is. And then just as a reminder, Alika mentioned earlier when she talked about GMAT volunteers, but at the April meeting, if you are on the GMAT committee, you will need to stay past the ending of the meeting so that we can discuss the applications and recommended awards for each of those agencies. So with that, our next meeting for Salt Lake is in person here at the Meadowbrook building. Hopefully the construction out front is under control by then. It's a mess. So if it's not, just know that it's currently one way going south on 700 West if you enter that way. So we will see everybody on Wednesday, April 22nd from 9 to 11. We're giving an extra half an hour because of the presentations for each of you to the GMAT to make sure everybody has at least a few minutes. And then the GMAT will stay beyond that. So if nobody has any questions, we're actually finishing up a little early here today, so we'll give you some of your time back. Alika mentioned that the conference and training for your drivers can qualify as an operations expense. So if you do get operations fundings from the grant, you can get 50% of that reimbursed through those funds. So anything else before we let you go a little early today? Okay, I'll give you back a half an hour to work on your applications.
Thank you.
All right.
Bye.
Thank you, everybody. We'll see you next time.
Thank you. Have a good day. Bye-bye.
You too.
Thank you.